Well, there are a number of structural problems that we can evaluate with ultrasound. First of all, we can look at both ovaries. Are they there? I've had patients come in thinking that they had both ovaries, having had surgery in the past, and only to discover that one ovary is not there. So it helps us be sure that all the anatomy is correct and in place. It also helps us to see the uterus. Is the uterus enlarged? Does it have what's called a fibroid tumor, which is usually a benign muscular growth in the wall of the uterus? It can be outside the uterus, hanging off the uterus. It can be in the wall of the uterus, or it can actually be in the inner part of the uterus where it's going to impact getting pregnant and staying pregnant. And that can be seen on ultrasound. If we put salt water or saline into the uterine cavity, we can look with ultrasound and we can see, are there little benign growths called polyps. A polyp is shaped like a popsicle or a lollipop, where it has a stalk and a bulb on the end. This can impact getting pregnant and staying pregnant. It also helps us to see, is there scarring in the uterus that we need to address that would prevent someone from getting pregnant or staying pregnant. And finally, with the use of three-dimensional ultrasound technology, we can determine the structure of the uterine cavity. Some women are born with abnormal uterine structure, and using an ultrasound with salt water helps us to look at and say, is there a partition or septum down the middle of the uterus that can be removed, which would enhance a woman's ability to conceive and stay pregnant.